As government, as stakeholders, civil society, this is an area that concerns all of us, and we need to support the efforts of everybody to see that our children, both boys and girls, get the necessary support.
During the dialogue, Member of Parliament for Bwemba County in Bundibujyo District, Richard Gafabusa, emphasized the need to prioritize adolescent health, especially by providing essential information to young people, particularly girls, about adolescent issues.
But also, even when we are adults, we are now parents. We have these children who are now adolescents, and we understand the need for a concerted effort as a country to support issues of adolescent health.
Gafabusa also stressed the importance of giving young people a platform to express their challenges and suggest solutions.
Now, when we are planning for some of these interventions, the mistake we do is to think that we can think for the younger people, these children. That is wrong. And that's why I'm happy for the organizers of this dialogue that we are here as policymakers, we are here as the implementers, technical people in the MDAs, but we are here discussing with the younger people themselves, and they are telling us what is good for them. Because we might plan, but what we are planning probably is not what the young people want.
Moses Bwire, the Executive Director of Peer-to-Peer Uganda, stated that the country's biggest challenge is not addressing the issue faced by the young generation, especially regarding adolescent health.
One of the biggest gaps that we are having as a country is when we talk about the health budget, it's blanket. It's talking about health infrastructure development, investment in medical supplies, health commodities, but it's not exhaustive to be able to address the gap around the indicators, which is the biggest percentage of the population. When you talk about Uganda's youngest population, we are talking about adolescents, the 10 to 19.
He emphasized the need to engage all stakeholders to influence health financing, particularly in addressing adolescent health issues.
But moving forward, what can we do different? If we are going to improve the country indicators around adolescent health, we must go back to the core of saying which is the biggest demography in terms of population dynamics, and how are we contributing resources to that specific population. And there is no better way to invest in a population than making sure that their health is right.
He also highlighted the need for young people to take keen interest in budgetary issues and participate to better understand the dynamics.
Hindering adolescents in terms of engaging in health advocacy or budget advocacy for their constituency, the 10 to 19 and including the young people, is there is a gap of interest. They think these are these are conversations that should only be embraced by the technical people, the elites, people who are doctors, professors, and highly competent people. But it has to start with you at the smallest level.
Some of the peer educators who attended the dialogue emphasized the importance of such engagement.
It's very useful to young people because when we come and give our challenges as young people, the stakeholders really have where to start from to budget for us.
It has helped the people who are planning for adolescents in the financial year of 2025, put us in the budget, and also help the demographic data to be evident to the issues that are being faced by adolescents.
They revealed some of the challenges young people face nationwide concerning adolescent rights, such as the lack of changing rooms for young girls in schools, inadequate information about adolescent issues, among others.
First of all, there are poor accessibility standards in the nation. There are some institutions that have tried, but really there is need for more intervention.
Like in schools, lack of changing room, it may cause children to drop out from schools.
Most young people down there are lacking sexual education. How? What I mean, schools are no longer teaching sex education.